Thank you very much, moderator, and good morning. In this occasion, we will present our research about the attitude of students, nurses toward end-of-life care, and evaluation of multi-methods approach in the clinical placement. As the background of my research were palliative care and of-life care are essential and inseparable components in the continuum of healthcare. Nurses is one of the healthcare team members, need to be competent and confident to provide palliative care and of-life care to improve patients' quality of life. However, to some extent, cultural and religious belief prevent student nurses to have open discussion about dying and death. Such situation may influence the student attitudes toward end-of-life care. The aim of the study was that the current study aimed to compare the attitude of students toward the end-of-life care before and after they involved in multi-methods learning strategies for one semester. And the methods that we have been employed was the pre- and post-quasi experiment study. The measurement of the students' attitudes was conducted twice at the beginning of the semester before the learning process was begun, and at the end of the semester when the learning process had been completed. Data were collected from all, and the number of those participants was 165 registered student palliative care unit using from mild attitude toward care of the dying scale form B or FAT code B in the Indonesian language version. Ethical clearance has been granted from the University of Ahmadiyani. This is the multi-methods learning strategy, which includes lecture, case-based study, project-based learning, role play, and also discussion. And result and discussion of the research, if we see table 2, distribution of frequency for pre-test and post-test, where the attitude for the pre-test mean is 103.36, and the attitude and for post-test is 108.29. Findings indicate that differences in students' attitudes toward end-of-life care after completing the course. The students were involved in a multi-method learning process with a mean of 36 and standard deviation about 8.55, and the mean after the learning process was increased to 108.13 with standard deviation of 9.14. As a conclusion is the attitude of the students toward end-of-life care was increased after they were involved in a multi-method teaching and learning process in one semester. A multi-method teaching learning strategy can facilitate the students' active involvement in the various palliative and end-of-life care scenario and patient. Thank you very much.